Hi guys, Ryan here from Advanced Physical and Aquatic Therapy, hashtag Advance Your Health video project. Topic for today is physical therapy myths. So there are a lot of myths out there that kind of hold people back from getting physical therapy, or they don't really understand what physical therapy is. They might have gone to physical therapy, they might have friends that have been there, they have an idea what it is, but they don't truly know the ins and outs, the thought process, and the education that goes into physical therapy. Also, physical therapy is one of the fastest growing healthcare professions in the healthcare landscape. So there are a lot of myths out there. Since it's growing, we like to dispel some of them. Here we go. Physical therapy myth number 5. You have to have insurance to get physical therapy. The truth is, physicians and your insurance carriers may tell you that you need insurance and you need to go through your insurance to get physical therapy, but there are plenty of out-of-network providers that will be happy to give you the utmost 5-star quality care and see you out of network while dealing with all the insurance complications for you. There are also cash-based options, so you can see your physical therapist that you may have a relationship with out of network. And these options can be made more affordable by possibly buying physical therapy subscriptions. There are cash-based package deals, and also there are even some clinics that offer a concierge PT. Physical therapy myth number 4, physical therapy is only stretching or massage. Now, physical therapy is much more than stretching or massage, although they may incorporate stretching and a little bit of massage, but we try to leave that to the professionals that are best suited for that, which is massage therapists, and they go to school specifically for massage. Physical therapy is a doctorate level of education, and it is very well thought out programming to get you healthy and moving better and pain-free and doing the things that you want to do in your lifestyle. Physical therapists use the latest treatment options that are based in research and evidence, such as strengthening, neuromuscular re-education, various modalities, creativity, and just that relationship that you see your physical therapist, you're meeting with them 30 minutes to an hour, a few times a week for a long duration. That relationship you develop of back and forth with a professional that is the expert on movement and mobility in your body, that is the biggest benefit and professional takeaway you get from physical therapy. Physical therapy myth number 3, physical therapists are only found in offices or outpatient clinics. There's actually many different parts of the healthcare system that physical therapists are found. They're in hospitals, they're in schools, they're in the home, in home healthcare. And one of the most exciting parallels to outpatient physical therapy that is currently going on and that we are offering in the very near future is telehealth. So you can video chat or Skype your physical therapist, and they can have a certain 15-minute to a half-hour consultation just to consult about what your injury is and your pain. And it's kind of like an exciting new venue that not a lot of people know about and are aware of, that physical therapy is kind of migrating to. Physical therapy myth number 2, physical therapy is expensive. Not true. Physical therapy is actually the most financially feasible and clinically effective treatment option compared to other less conservative treatment options such as pharmaceuticals, injections, and even surgery. In fact, if you were told you need a back surgery, just by seeing your physical therapist, you will have better long-term results and better outcomes just by going to see them. In fact, if you see them once a week for 20 years, that would still be cheaper than getting one back fusion surgery. And last but not least, physical therapy, you need a referral to go see your physical therapist. That is not true. We have direct access in the state of Pennsylvania and in most other states where you can see your physical therapist without a physician script. Typically, it's for the first 30 days of treatment, but you can get a script after that. Also, you can pay out of pocket and go see your physical therapist, not even using insurance, so then the script is kind of taken out of the equation. Physical therapists are definitely equipped to assess and diagnose orthopedic injuries. If there's anything that is beyond their scope, they will, of course, be medical professionals and refer out. Physical therapy, you do not need a script. You can see that therapist that you've built a relationship with. Just like I talked about in the previous topic of building that relationship with your PT, you want to go and continue to go to that person that you have built that trust and relationship with.